All right, Coach Jeff here. This is this week's movement enhancement technique or exercise. I already did this once, and I felt that it might have been too much stuff to do all at once. So I'm going to break it down, and I'm going back into this, and I'm going to start with what can be the most important part of that earlier version of the MET. So again, this is just part of what we would do to help someone with hip mobility or hip pain. All right. So we're going to focus on 4 muscles, just 4, where I had a whole bunch last time. There's more to it than just 4, but keep that in mind. I'm just saying we're going to work on 4, and they're the glute muscles. So we got, well, 3 of them are glute muscles. 1 of them is a hip flexor, okay, and a internal rotator of the hip, and also a hip abductor. But we got glute medius, glute minimus, glute max, and the tensor fascia latae. Okay, those tend to be the ones that I always end up working on as a orthopedic massage therapist, pain management specialist, when someone's having hip pain or even hip mobility issues. So we'll focus on those, and I feel that if you do these things, that's going to help you and go a long way. All right, here it is. So again, anytime we're going to do pain management or performance enhancement, improved movement, we always want to make sure that we are more at a parasympathetic balance. So we start the session with breath work. It's too powerful to leave breath work out. Too much benefit to just skip it. So our most basic version is in a supine position, legs are up. This kind of aligns our core, keeps our lower back neutral, or as neutral as possible. And then we're going to inhale, hold for a couple of seconds, exhale, hold for a couple of seconds, inhale, hold for a couple of seconds, and then we repeat that process. And that would be considered a 2-minute box or 2-second box breath. And you're going to do this for, at minimum 3 minutes. Do it for 3 minutes. I mean, I've shown you in other videos that I do 5 or 10 breaths, and the results are pretty amazing. Okay, just by doing breath work. And again, I want to say that there's all kinds of ways to do breath. This is the way we choose to do it, though, or one of the ways. Okay, so after you do the breath work, I would do a general foam roll. Just do a total body foam roll. Spend a minute on each body part. Just do that, and I will just take you through it real quick. Because as we know, that one part of the body can affect the other part of the body. Now, if you especially start talking about myofascial slings and chains. Okay, so our basic routine is calves, then hamstrings. Set a timer, go for a minute or 2, whatever you want. You do a minute per body part, then I'm going to show you that's 10 minutes. Then you're covering one of the hip muscles already by doing this one. This is your glute max. Right side, right legs crossed over. Try to keep tall spine. And then I'm just going to work all over. I'm even actually getting glute medius here. The more anterior or posterior side of it. Okay, so glutes. And then I'm going to do lower back. And I'd like to emphasize one side at a time. Most of you that have been in our program know this very well. So then I'll take another minute and do the other side. All I'm doing is just gently rotating to the side that I want to emphasize. And I can also hug myself and work the thoracic spine. Okay. Then next step is the glute. I definitely need some self-myofascial work. Feeling it. Hamstring. And be mindful, you guys, don't just blow through this stuff. You know, like I'm gonna focus on the center of the leg, turn my toe out, focus on the lateral part, turn my toe in, and then I start getting more medial and maybe even a little bit of the adductor group, especially like the more posterior one, the adductor magnus. And then calf, same thing. Turn your toe out, straight up, turn your toe in, and work the different parts of the calf. Okay, and then once I'm done with that, same idea with the quad. I'm going to break it up into three sections, basically the very top, the lateral, and then inner thigh. I just turn this and work on it that way. Okay, and again, reminder, try to keep neutral spine. Don't let your hips sag and put pressure on your lower back. All right, so after the foam rolling, 4 muscles we're gonna focus on. One is basically right here, kind of the anterior lateral part of the hip. That's the tensor, fascia latae. It's between the ASIS and the greater trochanter, inserts on the, and it is on the tendon for it is the IT band. So it goes right into the IT band, down into the knee. Lateral glute max does the same thing. It goes right into the IT band, into the knee. Okay. So that being said, TFL, pretty hard muscle to work on yourself. What I do, get the old lacrosse ball out, and I'm just, generally speaking, these are pretty tender for most of us. So I'm going to start you off on the wall. Again, so I'm going to put the ball more anterior lateral. You'll see it. Okay. And then I'm going to bear weight on the outside leg and let my inside leg relax while I roll that TFL. So that's a good way to start, especially if it's super tender. But eventually, you're probably going to have to do it on the floor. And I'm just going to sit on it. And yeah, that's quite a bit deeper pressure, a little bit more uncomfortable. But if you have hip centration issues, hip pain, this one muscle can cause a lot of it. Okay, so once you get done and you feel either some of the pain decrease, maybe 50%, or it feels like there's less pressure, that's when you know you got some the muscle to relax or to release. So next one is going to be glute minimus. So TFL's here, glute minimus is going to be right there. Just kind of going right there. Glute medius is underneath or over the top of glute minimus, so you're actually getting glute medius, especially the anterior part of it, at the same time posterior part's back here. Kind of comes down this way. Okay, so again, the crust of your ilium, or the crust of your hip, is where the muscle starts, and then it goes down onto your femur at the greater trochanter. So work that. If you got hip pain and you're not working on this, you better get on it. Because this could be a game changer for you if you're trying to manage hip pain. And then if you're trying to get improved hip range of motion, I mean, obviously there's other things that we need to look at, but this is a huge part of that. Okay, so again, I was just using the wall as support, rolling those muscles. Same thing if you do it on the ground. I'm just pretty much laying on it. This leg is crossed over to help me maybe manage some of the pressure. Maybe put a pillow here to keep you more neutral. And then I'm just going to lay on that ball and breathe. Okay? So that's the self-myofascial release part of it, and that in itself can be super beneficial, super huge in reducing pain. Taking a step further, if you want to do some stretches, you can do like a pigeon pose. Stretch that external rotation. So just be careful of your back. Okay, I like this one, it's pretty good. Honestly, if I'm going to stretch that, I'm going to use this stretch here. I'm going to do the elevated pigeon, or I think the FMS calls it stride with hip rotation, hip external rotation. Notice I'm trying to stay nice and tall. I'm not going into the stretch. If I want to increase my stretch, I'm just going to get deeper into it, not by leaning forward so much. Okay, so those are a couple stretches you can do for the glutes, glute max, external rotators of the hip. For the TFL, this one's a little bit harder to do. You're going to need a band. What I do here is I double loop. I'll show it to you. I put my foot in, then I wrap around, and then what I want to do is bring this strand of band around my leg, and when I pull it, you can see it turns my leg, or externally rotates the leg. My toes are pointing out. And then once I get that position, I'm going to lower it and then bring it across, and then I'm getting this slight lateral hip stretch. Okay, so that's the TFL, glute medius, glute minimus, and glute max. Okay, one exercise you probably should do after that, after the stretching and the foam, or the lacrosse ball and foam rolling work, breath work, is I would do a hip quadruped rock back. Just practice this. And this can help with mobilizing the joint, keeping spine neutral. This has helped for centration of the joint. Great exercise. It also helps with assessing your squat pattern. Okay, so make sure your tailbone isn't rolling or tucking under, or you're doing what we call butt wink. When you're rocking back, stay neutral spine, and if you just go as far as you can, maintaining neutral. All right, you guys, that's this week's MEE, or MET, I should say, movement enhancement technique. I hope you find it helpful and useful, and if you're having pain or mobility stuff challenges, this should help you.